Seasonal affective disorder, known as SAD, is a type of depression that affects many people each year around the world. It's more common in women than in men, however it's also believed that the symptoms that men experience are more severe. It's less common in children, but starts to become prevalent after the age of 18. People who live farther north of the equator are at a greater risk of developing SAD. Symptoms can include an increase in appetite and usually a stronger craving of carb-based foods, lethargy, social withdrawal, general sadness and depression, lacking of motivation or a loss of interest in things that normally bring joy or interest, a decrease in sex drive, low energy, difficulty concentrating, agitation, and continuous need to sleep more, which can lead to oversleeping. The winter blues is something that many people around the world experience every cold season. It's no surprise, as the cold temperatures and dreary weather can naturally affect someone's mood and behavior. But more specifically, SAD is marked characteristic by two patterns. In order to be diagnosed with seasonal affective disorder, you must meet the following. Your depression must only occur during a certain season and subside when the season is over, and you must have this reoccurrence for at least 2 years in a row. There is something known as summer affective disorder, but it's very rare and the symptoms are opposite of those of the winter kind. Most people who suffer from winter depression start experiencing their symptoms in the fall. These symptoms usually do not subside until February. A lot of research has been conducted as to why some people experience SAD while others do not. Strong research suggests that low serotonin levels are to blame. This does make a lot of sense, considering that many people who experience general depression throughout the year are recommended by doctors to take SSRI, selective serotonin reuptake inhibitors. These antidepressant medications are designed to boost and balance serotonin levels. Serotonin plays an important role in appetite, sexual function, mood, and behavior. Melatonin, on the other hand, does play an impact on mood, but it also helps regulate sleep. In the wintertime, it's possible for the human body to produce too much melatonin while depleting serotonin. This is because more melatonin is made in the body under a favorable condition. That condition is darkness. When you go to sleep with the lights out, it's a perfect environment for melatonin. And in the winter season, there aren't as many hours of light in the day. It's a perfect breeding ground for melatonin and hibernation instincts. This may also be why people who live farther away from the equator, where the days can be even shorter, have a greater chance of suffering from winter seasonal depression. There are many helpful things that can be utilized to combat this mood disorder, but the most popular and well documented is phototherapy. Phototherapy is light therapy, and it's a method for getting more light during the winter. This is impossible as the sun sets earlier in the day, but special devices known as light therapy boxes, or sometimes called SAD lights, are designed to emulate natural sunlight. They do this by putting out 10,000 lux of light, which resembles a sunny day. Only use a device like this if you are sure that there is a special UV filter. UV rays are harmful to the skin. Luckily, many manufacturers of light therapy boxes have taken this into account. A lot of research has been conducted on the efficacy of light boxes, and the results are pretty promising. Many doctors and psychologists are also aware of these devices and sometimes recommend them to their patients. The best time to use light therapy is in the morning. The reason is because if you use a light box at night, it might be too stimulating and you may have trouble falling to sleep. Research shows that people who use their light boxes in the morning from 15 to 45 minutes, depending on the patient's needs, typically see results within 1 week and even better results within 2 weeks. Phototherapy is believed to offer a lot of benefit to brainwave activity and to boost mood. Antidepressant medication may also help alongside this kind of therapy, but only your doctor can advise you on this. Diet is also important. You should always try to eat foods rich in vitamins and minerals. Fatty amino acids are also important, and some of the best sources of omega-3 fatty acids are fish, such as salmon. Try to avoid consuming too much caffeine and especially alcohol. Alcohol is within itself a depressant. Science has also proven that routine exercise releases dopamine, which is also known as the feel-good hormone. Make sure that you also drink plenty of water in the wintertime, even if the cold, damp outside conditions make you feel that you don't need hydration. There are lots of vitamins that you can also take. The most important one is probably vitamin D. In fact, there is so much research around the D vitamin and its positive effects on depression that it is overwhelming. Other important vitamins that may help include the B and C vitamins, as well as magnesium. Sometimes people with winter depression have trouble getting to sleep, despite the fact that they may end up sleeping too much during the winter. Calcium tablets and/or warm milk may benefit people who have trouble sleeping. Another suggestion is to drink a decaffeinated mint tea. Mint has a very calming effect on the body and mind. Also consider investigating magnesium powder. There are lots of options for this, and many magnesium powders can be bought online or in a health food store. Magnesium acts as a de-stressor, and it is very calming. Truth be told, most people do not get enough magnesium from their diet alone. For tips about managing seasonal depression, information about phototherapy, and reviews of sad lights, visit sadlamps.org.